Hello. Whenever a new drug is introduced or a drug is used for a new indication, the medias take this to the public. But while doing that, sometimes the inference we get may be a wrong inference. Sometimes it happens. So when this comes to the government's knowledge, immediately they temporarily suspend that drug till the misconception is solved. So I'm talking about a drug which is there for a long time, now is used for another indication. The drug name is pilocarpine, the brand name is PRESBYOPIA, and the indication is presbyopia. This pilocarpine is not a new drug, the indication is new. So what is this drug used for? Usually this drug is used for what is called glaucoma, an increased intraocular pressure. To reduce the pressure inside the eyeball, we use this drug, pilocarpine. The drug is now promoted for presbyopia. So what is presbyopia? See, this is not a disease or a disorder. Presbyopia is a problem which occurs due to age. After 40 years, everybody gets this problem, almost everybody. What is that actually? When you read a book, you just keep the book at a distance of 25 centimeter or 30 centimeter, around 1 foot. As age advances after 40, slowly you increase the distance between your eye and the book. How much you can go? Up to your arm length. After that, you cannot. But we are trying to do that. We are increasing the distance between your eye and the book, knowingly, unknowingly. You want to read, after all, I'm keeping it a bit distance. It's not a big problem. Some people may not like to wear a glass also. But finally, you end up with a glass and the doctor prescribes a glass. What is lost in these people? What is the real problem in these people? First thing. Second thing, how this drug solves the problem? Everybody wants to know. Many people think because of the advertisement marketing that you don't need a glass to read. Immediately they believe that when I use this drug, I will not require a glass. It's not like that. That is why the problem. That is why it is suspended. What really happens in these people? So you have a near vision and a distant vision. The eye can accommodate this. Suppose you see an object, a distance object, that also you see, a near object, that also you see. How does it happen? In a camera, you have a lens, you have an aperture, and you have a screen. You adjust the lens to get a focus, moving in front and back. You adjust the aperture so that you can control the quantity of rays which is falling in, getting into the camera. This is how a camera works for a distant object and a near object. But what happens in an eye? The eye has a lens, of course. The lens cannot move front and back. So it's not exactly like a camera. The aperture in a camera you adjust, but here you have something called the pupil, the circular black opening in the center of your eye. That increases its diameter or decreases its diameter to control the quantity of light which is entering. If it's a dark place, if an object is seen from a distant object, the pupil dilates actually to get more light from the distant object. If you want to see an object which is near, the pupil constricts. It may constrict even up to 2 millimeter. It can dilate up to the extent of 8 millimeter or 10 millimeter. This is one thing. The second thing is the eyeball, they converge. They come nearer to the bridge of the nose. You call it convergence. The third thing is, when you see an object, a distant object, the lens is usually flat. Then only the lens can focus, create an image on the screen, the retina. When you see a near object, to focus on this near object. The lens becomes, from a flat lens, the lens tries to become like a small ball. This is to adjust the focal length so that you are getting the image clearly for a near object. For this, the lens tries to increase or decrease the focal length. So this capacity, increasing or decreasing this focal length, is lost in presbyopia. This increasing or decreasing the focal length is due to the flexibility, the softness, and the elasticity of the lens. These three characters are slowly lost as age advances. So this accommodation, this reducing the focal length, is lost by this lens. That is why you are not able to read books. Presbyopia comes. So in these three things, what we can do is we cannot do anything with the lens, and the convergence is already there. There's no problem. Only thing is, what you can do is, by constricting the pupillary size, you can solve the problem temporarily. The concept is a pinhole camera. You take a small box, you put a small hole in one side, the other side you paste a butter paper. Now you can see an image of this object which is in front of the opening. There's no lens here, there's no adjustment. The same concept here. If the opening which allows the light is restricted, or the pupil is constricted, something like a pinhole camera, you can get a clear image of the book you are reading, of the letters you are reading. This is the concept. But what is the problem with this? It's not a solution. It doesn't solve the problem. It only gives a relief from using a glass temporarily. Now, what are the other things you want to know? When to use this while reading? How much to use? 1 or 2 drops. How much time it will take to act? 15 minutes. How long it will act? 6 to 8 hours. That's all. After 6 to 8 hours, you have to apply the drops again if you want to read. And it all depends upon when you apply this or instill these drops. How long you want the effect, you will decide. But remember one thing, the natural process of increasing the diameter and decreasing the diameter is lost here. Artificially, by applying a drug, you are not allowing the pupil to increase the diameter for 6 hours. What will happen now? During the evening, what happens? You get a dim light. At that time, the eye needs more light to see an object. When you really need more light, this pupil should dilate, but the pupil is under the control of drug, so it will not dilate. At that time, you cannot see objects clearly when there is a dim light. What's the other problem with this? You may get allergy to this drug. You may get some irritation and you may get some headache. Not a big or major problems. But if you continue this for longer time, very frequent, months, years like that, you may get a problem in your retina. Definitely that's a big problem. But that occurs only when very frequently you are using and misusing this drug for a longer time. That is why I said it's a prescription drops. You are not supposed to go to the medical shop and get this. It is not an over-the-counter drug. You have to discuss with the doctor and you have to check whether this drug works for you, because the result differs from person to person. For some people you'll get 50% relief. For some people 78%, because the constricting effect, the meiotic effect is not very same with everyone. You have to be very careful in that also. So I have told the concept of this drug, and I have told the problems with this drug, and I have told this is not a solution completely. It doesn't cure the cause, or it doesn't take away the cause. It only gives a temporary solution to the effect. Whenever you get a news whenever you get an information through medias, through social medias, through your friends, through the TVs and all, don't just carried away by the information. You have to discuss this with your doctor. But now, because of this advertisement, marketing, which gives a false impression among the people that this will solve the problem, you will not need a glass and all. That is the reason why it is suspended. It is not banned, it's a temporary suspension. And the manufacturers of this drug have gone to the court saying that it's been used in foreign countries since 2021. Nothing, no serious effect has been reported, and we have not done anything wrong. We have not projected this drug for any other condition, and we got the permission, the permission from the drug control department after assessing the benefits and risks. So they have gone to the court. It will come back actually. You can use it judiciously after getting a proper prescription from the doctor. Well, that's what I wanted to share with you. We'll meet again in some other video. I'm Dr. Balasubramanian. Thank you.